As of right now, it's clear that our response to the coronavirus outbreak needs work. Public health officials are unable to tackle the COVID-19 outbreak effectively because oftentimes the solutions we implement are reactive rather than proactive. Both public health officials and elected officials are addressing the issue at hand by allocating beds, medical staff, and other resources along with establishing testing centers far too late. These actions are being taken long after these communities are well on their way to hitting the apex of their outbreak. New York City is a prime example of this. Now an epicenter of the outbreak, New York City officials were unable to take the necessary precautionary steps to protect their city. Due to the lack of available information to predict areas that were likely to become highly infected, New York was unprepared and could not take preventative measures. To lend more evidence towards the importance of this problem, Time magazine states that only those states and cities that voluntarily report at a more granular level can lend us real insight into who is suffering the worst and to what degree. The more that do so, the better prepared the nation will be to confront the next emergency. The current system set in place does not focus on identifying the probable hotspots of the coronavirus with the potential to become highly infected. The CDC and Johns Hopkins only reports confirmed cases with minimal reporting of probable COVID-19 cases. Probable cases are defined by individuals meeting clinical criteria and epidemiologic evidence of having coronavirus without any confirmatory laboratory testing performed for COVID-19. There is a large need for improved data collection that not only stratifies data but also identifies probable coronavirus hotspots. So here is our solution. Our solution involves the implementation of a data collection system to help healthcare professionals identify probable COVID-19 hotspots from public transportation users. For the purposes of simplicity, we would like to limit the scope of our solution to Metro Atlanta public transportation methods through MARTA Train. With our idea, we would like to implement a temperature scanner and demographic data collection system on MARTA Train to collect valuable data correlating temperature, demographics, and COVID-19 symptoms to reveal probable COVID-19 hotspots. The primary body that would benefit from our solution is the Georgia Department of Health, as we would be providing them valuable data to inform their decisions on how to respond to the pandemic effectively.
Let's walk through a demo to understand how the solution will be implemented. When users purchase their MARTA ticket at a kiosk, they would be prompted with answering a few additional questions regarding their demographic information, specifically their race, gender, age, and zip code for location data. They would also be asked to identify key COVID symptoms highlighted by the CDC, including cough, shortness of breath, chills, muscle pain, and sore throat. Upon receiving their ticket, they would walk towards the turnstiles to enter a station. At each turnstile door, we will attach an infrared temperature sensor to gather riders' temperature readings as they pass through the gates. Only one thermographic camera is needed to monitor all the turnstiles in a station's entrance. This temperature data, coupled with the individual's demographic information, would be uploaded to a central database that is accessible to the Georgia Department of Health. With this crucial data, professional health officials can create analyses and visualizations to assess risks in different areas.
The impact of our data collection system is far-reaching. This system provides the Georgia Department of Health valuable data about COVID-19, helping inform their decisions in developing an improved response to the pandemic. Many official health departments, including the CDC and Johns Hopkins, have noted the importance of understanding demographics in the spread of the virus. Therefore, we place a large emphasis on understanding which demographic factors, such as low income, contribute to poor health. This information can help health officials reallocate resources to the highest risk populations. Furthermore, states can begin to identify areas that are most likely COVID-19 hotspots, providing the data for states to make informed legislative decisions like whether to open businesses in the area. This solution extends beyond just this pandemic. We can use this data to identify the most vulnerable and high-risk areas all throughout the country, which can help prepare for a second wave of COVID-19 or for a future pandemic. While we are starting by implementing this solution specifically in MARTA systems in Georgia, we plan on expanding the scope of this idea outside of the Metro Atlanta area to metropolitan hubs across the U.S. in order to identify COVID-19 hotspots throughout the country. We will broaden the subway transit system to include other forms of public transportation, which will help us collect more representative information.
We have learned from past experience that gathering more data is imperative in protecting the society when such widespread epidemics arise. Our solution will not only help ensure proper legislative decisions are being made, but it will also help us prepare for any future pandemics.